Okay, so this one's a little bit shorter, but short and sweet and right to the point. So the question that was asked was, when you go to do a patient check, before you check the patient or the ventilator, what are two things you should look for or do? And so for myself, I picked the two things that you should do right away. Are the first thing is you check to see if the patient is in sync with the vent. What this means is they aren't fighting it. They aren't in any distress. There aren't any alarms sounding. You'll see bilateral chest movement, and the patient is returning appropriate volumes. You can also look at this real quick by just taking a quick scan of their vitals, seeing what their heart rate is, what is their respiratory rate, and what is their SpO2. The second thing you should look for is make sure that they have a BVM, which is a bag valve mask resuscitator. And so bag valve mask resuscitator, and that should be at the bedside, because if there is an emergency, whether the patient is trached, whether the patient is tubed, or they're just strictly breathing on an oxygen therapy device, or even just on room air, if they code, you can always bag the patient. Remember, you can hook up the device to the ET tube or trach, or if something goes terribly wrong, you can always take out the ET tube, or block the trach, or take out the trach in extreme emergencies and bag the patient. Now, let's say that something was going on with the ventilator. You could always take the patient off the ventilator and bag them as well while you troubleshoot or fix the issue that's going on with a ventilator. But the bag is also super important. Some quick things that you should also that were up there for choices you should make sure that you have is, especially with trach patients, make sure that you have additional size trachs at the bedside. Typically, they say at least one of the same size and one just slightly smaller. So if something happens, you can still get that in with the smaller one. But that's just in case they pull it out, or it comes out, it comes unattached, and whatever happens, you have some extra trach sizes quick that you can put in. That's all. Thanks.